On today's episode, I want to talk about a fairly common problem, thyroid dysfunction, and how it can manifest as problems with sleep, even contributing to specific sleep disorders. I'm Jay, and this is Somnilopod. Hello, everybody. Welcome back. I am so glad that you joined me. It is a nice sunny day here as I'm recording, so I'm hoping that the weather is pleasant for you as well. I wanted to address a listener question that I thought deserved a full episode just because it can contribute to a lot of different things. Specifically, a listener in Texas asked if there was an association between thyroid issues and sleep disorders. So I wanted to give that some proper investigation. Now there are a lot of disease processes that or dysfunctions that can manifest as sleep disorders or contribute to specific types of sleep disorders, and thyroid dysfunction is one of those. Now, what is the thyroid? Thyroid is a gland that is sort of butterfly shaped, and it's in our throat, right below the area of the Adam's apple. So it's in a very important spot. We'll get to that in a little bit. But what it does for us, it helps maintain a lot of different processes in the body, including body temperature maintenance, digestion, and other vital functions like heart rate and respirations. So you can imagine that if something goes wrong with that, they need to be addressed. So there are two different ways that the thyroid typically will cause issues. It will be either overactive or underactive. Now, of the two, hypothyroidism, which is an underactive thyroid gland, is a lot more prominent. In the United States, there are about 5% of the U.S. population is affected by hypothyroidism. Whereas with hyperthyroidism, and that's the overactive thyroid, the population that is affected is about 1% in the United States. So I want to talk about the different types of symptoms that can be associated with both hypo and hyperthyroidism. We'll start with hyperthyroidism. That's an overactive thyroid gland. Now, there are diseases that can affect this. Specifically, Graves' disease is one. One of the things that patients with hyperthyroidism note is that they have symptoms like weight loss and rapid heart rate, excessive sweating, diarrhea, nervousness. You can imagine with those types of symptoms that there would be some effect on an ability to get a good night's sleep. So what we have seen is that in patients with hyperthyroidism, they have difficulty getting to sleep, so it takes them a little bit longer to get to sleep, they have more difficulty maintaining sleep as well. And then as a result of this, they have higher chances of excessive daytime sleepiness. So their sleep is really affected by this increased level of rapid heart rate and nervousness, and sometimes night sweats as well, the excessive sweating. Studies have shown that there is a direct correlation between the levels of some of the hormones from the thyroid in the blood and the severity of the insomnia, the symptoms that the patients present. And additionally, with hyperthyroidism, it can also worsen conditions like anxiety and depression. And we know from previous episodes that those are two things that can and do affect our ability to get a good night's sleep and can increase our chances of insomnia. Interestingly, there is also another type of sleep symptom called restless leg syndrome that patients with hyperthyroidism can experience. Restless leg syndrome is a disorder that causes an excessive need to move the legs at night, specifically when you're just trying to go to sleep. So patients with restless leg syndrome have this creeping, aching sensation in their legs, and it is only alleviated by moving the legs around, moving the feet, sometimes getting up and walking around. In some patients, it can take them hours to get over those symptoms enough to be able to get to sleep. Some patients suffer from it all night long. There is an increased prevalence of restless leg syndrome in patients with hyperthyroid disease as well. Now, on the opposite side of the coin, hypothyroidism can lead to symptoms of insomnia as well. One of the things that patients with hypothyroidism complain about are cold intolerance and muscle and joint pain as a result of their underactive thyroid. They also can have increased anxiety. So all of those things are going to lead to a difficulty getting to and staying asleep at night. Interestingly, patients with hypothyroidism also have an increased chance of having a disorder called obstructive sleep apnea. In patients that present to sleep disorders, roughly 9% of women and 24% of men also have, associated with their sleep problems, a thyroid dysfunction issue. So those numbers are pretty impressive. So it's interesting to see the interplay between two different types of disease processes. So what scientists consider is happening with obstructive sleep apnea and hypothyroidism is that as the dysfunction of the thyroid increases, it actually causes the thyroid to swell. Now, I mentioned earlier that it is located in the throat, right below where the Adam's apple is. So you can imagine if that gland is swelling, it can actually compromise the upper airway, cause swelling in the upper airway, and cause it to not be as large as it normally would be. And with obstructive sleep apnea, we know that when there is that loss of muscle tone in the airway closes off. So if there's less upper airway to be working with, chances of sleep apnea are going to be a little bit higher. That's one of the symptoms, or one of the processes that scientists believe is happening with obstructive sleep apnea. There is also some speculation that since the thyroid does help control respiratory drive, that it can be affecting some of the muscles that help us breathe, specifically the diaphragm. So that may be a contributing factor there as well. So patients with obstructive sleep apnea, typically when they present to a sleep disorder, the sleep disorder physician will ask them questions about their thyroid and may even recommend some types of blood work. Now, typically with thyroid disease, your primary care doctor can diagnose this and treat it. It is something that they would typically just do some blood work through the lab. If it is something that they feel needs to have a little bit further, more specific attention, they may send you to an endocrinologist to get that taken care of. But for the most part, thyroid issues are very easily treated. And once the thyroid issues are treated, the sleep disorders tend to resolve on their own. One thing that we have seen in the past is that we may go ahead and treat both issues at the same time. So, for example, if a patient with thyroid issues has obstructive sleep apnea, it's going to be important to help them get a good night's sleep. So we will treat the sleep apnea along with the thyroid issues and then reassess or reevaluate after the thyroid is under control to see if the sleep apnea is still present or still needs treatment. And then if it doesn't, then the patients can come off of that treatment and just continue with their primary care doctor with their thyroid disease management. I hope this has been interesting for you. Please keep sending me those questions and keep referring that information to me. I'm happy to address any types of issues like that, and hopefully down the road we'll see some more episodes like this with regard to other disease processes and how they can affect sleep. In the meantime, please remember to like and subscribe on Apple Podcasts, as well as any of your podcast services. Also, remember to follow me on Instagram and Twitter, and then check out some of the YouTube content as well. Until we talk next time, please remember to keep sleep a priority, and I hope that things go well for you. Thanks so much. Bye-bye.